A simple blood draw can reveal how well your kidneys are filtering waste. If your creatinine has crept up poor, you're trying to protect kidney function. Your plate can be part of the plan. Today, we'll walk through 9 kidney-smart fruits. How they may help lower creatinine indirectly. Practical serving sizes. Buyer's tips, easy ways to use them, and who needs to be cautious. Stay to the end for a 1-week fruit rotation and a quick action. Checklist you can start today. Quick refresher, creatinine. GFR, and what high men's creatine is a normal waste product from muscle metabolism and dietary protein. Healthy kidneys remove it via the glomeruli, the microscopic filters bundled inside each nephron. When filtering slows, serum creatinine rises and eGFR falls. Common drivers of kidney damage include long-standing high blood pressure, diabetes, and obesity. Early CKD is often silent, which is why routine labs and urine albumin-to-creatinine ratio (UAC) checks matter. Diet cannot cure kidney disease, but patterns rich in fruits and vegetables, fiber, and antioxidants can improve blood pressure, vascular health, and inflammation, all of which support better kidney outcomes and can help creatinine trends over time. How fruit helps. And how much to eat. Antioxidants and anti-inflammatory compounds, vitamin C. Polyphenols like anthocyanins, quercetin, resveratrol help protect glomeruli from oxidative stress. Fiber, especially soluble fiber, binds bile acids and some dietary toxins in the gut, reducing systemic burden. Vascular support. Potassium in appropriate amounts, nitrate pathways. Endothelial benefits can ease blood pressure, stress on filters. Hydration from high water. Fruit supports healthy perfusion and urine flow. General serving guide for most adults with early CKD or at risk. 2 cups of fruit, day. About 2 servings within calorie needs is reasonable. If you have potassium restrictions or are on dialysis, your nephrologist dietitian should personalize portions. The list: 9 fruits that support lower creatinine and kidney health. 9. Apples. Why they help. Rich in pectin-soluble fiber that binds compounds in the gut, easing systemic load. Quercetin provides anti-inflammatory antioxidant support. Suggested serving: 1 medium apple day, approximately 200 milligrams potassium. How to use. Eat whole with skin. Slice into salads, simmer with cinnamon, or blend into a fiber-forward smoothie. Buyer's tips. Choose firm fruit with smooth skin. Refrigerate in the crisper. Rinse well. Watch outs. High fiber can cause gas for some. Reduce gradually and hydrate. Cranberries. Why they help. Proanthocyanins reduce bacterial adhesion in the urinary tract, supporting UTI prevention. Infections can worsen kidney function. Also provide vitamin C. Suggested serving: 1/2 to 1 cup fresh, frozen cranberries, cooked or blended. If using juice, pick unsweetened and dilute to reduce sugar. How to use. Simmer with a little orange zest and water. Add a spoonful to yogurt. Blend a tart spritzer. Buyer's tips. Look for firm, bouncy, bright berries. Rinse just before use. Watch-outs can interact with blood thinners and some acid reflux meds. Large supplemental doses may cause GI upset. Check with your clinician if on interacting meds. Mixed berries, blueberries. Strawberries, raspberries. Why they help. Abundant anthocyanins plus vitamin C and small amounts of vitamin E. Fiber supports lipids and gut health. Suggested serving: approximately 1 cup day. Mixed berries. Typically 77 to 121 milligrams potassium per 100 grams. How to use. Stir into oatmeal, yogurt, parfaits, salads, or freeze for smoothies. Buyer's tips. Choose plump, vividly colored fruit without mold. Enjoy within a few days. Watch-outs. Vitamin E supplements can accumulate in advanced CKD. Food sources are fine. Avoid high-dose supplements unless prescribed. Grapes: red, black, Or green, why they help. Resveratrol and other polyphenols. Combat oxidative stress and support vascular function and blood pressure control. Suggested serving: 1 cup per day, approximately 286 milligrams, potassium. How to use fresh as a snack. Frozen grape pops, sliced into grain salads. Buyer's tips: firm, plump grapes tightly attached to stems. Refrigerate and rinse well. Watchouts: approximately 15.5 grams sugar per 100 grams mined portions. If you have diabetes or prediabetes. Watermelon, why they help. Approximately 92 to 93% water for gentle hydration. Contains L-citrulline, gives allergeny, supporting nitric oxide pathways and blood flow. Helpful when mild dehydration is contributing to higher creatinine. Suggested serving: about 2 cups day in most people without potassium limits. How to use cubes with mint and a squeeze of lime. Blend into a chilled drink. Buyer's tips: heavy for size. Creamy yellow field spot, dull rind. Deep, hollow sound when tapped. Watchouts: discuss portions. If you have diabetes, rapidly digestible sugars, or potassium restrictions. Pineapple, why they help. Provides vitamin C and bromelain, associated with anti-inflammatory effects that may indirectly benefit kidney tissues. Suggested serving: approximately 1 cup fresh chunks, approximately 180 milligrams potassium. How to use grilled rings with chili lime, salsa with cilantro, or blended with cucumber. Buyer's tips: sweet aroma at the base. Slight give when squeezed. Green gold skin with a few yellow tones. Watchouts: bromelain can interact with blood thinners and may irritate the mouth. Moderate intake and consult your clinician if on. Cherries, why they help. Anthocyanins and quercetin deliver antioxidant and anti-inflammatory effects, supportive for vascular and metabolic health. Suggested serving: approximately 1 cup pitted cherries. How to use: fresh snack, compote with minimal sweetener or mixed into yogurt. Buyer's tips: plump, shiny fruit with green stems. Refrigerate. Wash before eating. Watchouts: provide potassium usually fine in modest portions. Confirm serving size if you're on a potassium-restricted plan. Lemons and other citrus used similarly, why they help. Vitamin C and citric acid may raise urinary citrate, discouraging calcium oxalate stone formation. Citrus polyphenols support vascular health. Suggested serving: juice from 1/2 to 1 lemon daily, diluted in water or used in dressings, marinades. How-tos: morning lemon water. Citrus vinaigrettes. Zest over fish, veggies. Buyer's tips: heavier thin-skinned lemons are juicier. Store at room temp or crisper. Watchouts: acid can irritate reflux and erode enamel. Use a straw and rinse with water afterward. Adjust if you experience heartburn. Pairs, why they help. Soluble plus insoluble fiber, approximately equals 3 grams. 100 grams aids gut transit and toxin elimination. Polyphenols like caffeic acid offer antioxidant support. Suggested serving: 1 medium pair, 206 milligrams potassium. How to use: fresh with skin, diced into slaws or lightly grilled with cinnamon. Buyer's tips: choose smooth, unblemished fruit. Ripen at room temp, then refrigerate. Watchouts: some varieties are higher in fructose. You track sugars for diabetes. Keep 2 sensible portions, for example, 3 times a week, and pair with protein fat for steadier glucose. Precautions and personalization. Potassium. Several fruits above are modest in potassium. Some days add up quickly. If you have advanced CKD or are on hemodialysis with potassium limits, get individualized serving targets. Some home or nocturnal dialysis regimens remove more. Potassium plans differ. Diabetes: pair fruit with protein. Fat, for example. Yogurt, nuts, cottage cheese, and aim for whole fruit over juice to slow glycemic impact. Drug interactions. Cranberries may interact with certain anticoagulants and acid reflux. Medications. Pineapple bromelain can potentiate bleeding with anticoagulants. Always share supplements. Major diet changes with your clinician. Stones. If you form calcium oxalate stones, citrus lemon may help. Balance high oxalate foods elsewhere and hydrate well. Allergies, intolerances. Just choices accordingly. Symptoms that may accompany higher creatinine or kidney trouble off. None in early stages. More advanced issues can include fatigue, swelling ankles, eyelids, foamy urine, more frequent urination, especially at night, high blood pressure, nausea, vomiting, reduced appetite, and sleep problems. Seek medical evaluation for persistent symptoms. Blood and urine, fever with flank pain, rapid swelling, chest pain, or shortness of breath. 3 big levers beyond fruit kidney-friendly dietary pattern. Emphasize vegetables. Appropriate fruit portions, whole grains, legumes as tolerated. Plant-forward proteins, fish, olive oil. Moderate sodium. Manage overall protein to stage plan. Risk factor control, tight blood pressure, and glucose management. Lipid optimization. Regular activity. Healthy weight. Limit alcohol. Avoid tobacco. Medication stewardship. Use NSAIDs sparingly under guidance. Review all meds with your clinician. Diuretics and ROS-modulating drugs may be prescribed to protect kidneys based on your case. 7-day Kidney Smart Fruit Rotation. Sample Day 1. Breakfast apple. Lunch grape cup. Dinner lemon vinaigrette on salad. Day 2. Breakfast berry bowl. Snack pear. Dinner pineapple salsa over fish. Day 3. Breakfast lemon water plus oatmeal. Snack cherries. Dinner watermelon side. Day 4. Breakfast yogurt with blueberries. Lunch cranberry relish, unsweetened, small portion. Dinner apple slices with almond butter. Day 5. Breakfast pear. Lunch grape and cucumber salad. Dinner pineapple grilled rings. Day 6. Breakfast strawberry parfait. Snack watermelon. Dinner lemon zest roasted veggies. Day 7. Breakfast cherries. Lunch apple cabbage slaw. Dinner citrus dressed quinoa bologest for potassium, sugars, and calories. Swap freely among the 9 fruits while keeping portions consistent with your plan. Simple kitchen playbook. Always wash fruit well, especially if not organic. Eat the peel when edible for extra fiber. Pair with protein, fat yogurt, nuts, seeds, cottage cheese, tofu to soften glucose spikes. Choose whole fruit over juice. If juicing, dilute and keep portions small. Hydrate steadily through the day. Don't cram fluids late at night to avoid sleep. Disruption Quick Action Checklist. Pick 3 fruits from this list you enjoy and can eat most days. Set portion targets. With your clinician, if you have potassium or sugar limits, build a weekly shopping list. Apples, pears, berries, grapes, lemons, watermelon, pineapple, cherries. Cranberries. Track blood pressure, fasting glucose, if applicable, and weight weekly. Recheck labs creatinine, eGFR, UACR. Electrolytes as scheduled to measure progress. Conclusion reflects how hard your kidneys are working. While no single food will flip a lab result overnight, a consistent kidney-smart pattern truly matters. Apples, cranberries, mixed berries, grapes, watermelon, pineapple, cherries,